Another really good resource to go to when you're looking for evidence-based practice resources is the Cochrane Library. The Cochrane Library is the place to go to find systematic reviews. So systematic reviews, as you might recall, are publications that put the evidence together from a whole bunch of other studies. So it is a secondary source, but it's a really great secondary source because it not only combines the findings of all of those studies, but it does so statistically if it's a meta-analysis, and it actually gives you a lot of good, rigorous data to answer your PICO question. So Cochrane Library, you're looking for systematic reviews. So again, main library homepage, you're going to click on the nursing guides on the left side of your page. Then you're going to click on find articles at the top. From the database choices, you will see Cochrane Library, which I have circled. That's what you're going to want to click on. And once you do, it's going to bring you to a totally different screen. It looks different than the EBSCO, where we look through CINAHL. It looks different than PubMed, where we look through Medline. So here we are going to look through the Cochrane Library. So we want to use our smart searching strategies. So we're actually going to conduct an advanced search. So you want to click on that box, which I have circled on the screen for you. And once you do, it opens up an advanced search option. So what I did is I went ahead and typed in the words I wanted to look up. Same search, cancer and music therapy and pain. We're still using those Boolean operators across all of these different platforms. Then we're going to click on search limits because we definitely want to limit our search. Okay, so I want just reviews. I just want systematic reviews here. So I clicked on that. You might also want to click on trials. I would not click on protocols. What a protocol is, it's basically kind of telling you how someone is going to do a study, but they have not done the study yet. So it's kind of like the first half of a journal article minus the discussion and the results. So it's the intro and the method, and that's it. So that's not going to be helpful because there's no research data there to give us an answer to our PICO or PO question. All right, so check reviews, maybe check trials if you want, but everything else you don't need to check there. And then you want to limit your search to the most recent 5 years. You can put the dates in there depending on when you're doing your search. And then I didn't do anything over here. This is all how it came up, and then click apply limits. Okay, so we've set our limits, and I know that to be true because it says I'm looking from 2014 to 2019, just reviews, and I've put in my search term. So I'm going to click run search. And when I do, note that it only gave me 2 hits. That's common. Cochrane, you're not going to find 100 and something hits because remember, these are systematic reviews. One systematic review may have reviewed 25 different studies. So even though you're looking at one study, it's a whole lot of studies. And it takes a lot of time to do these systematic reviews. So there's not going to be 15 systematic reviews on a topic. Probably. You're probably only going to find 1 or 2. Now note, some of the things you find on here are going to be close to your PICO question, but maybe not exact. So read the titles. Like I've told you before, it's going to be helpful. So let's look at the second one. Dance movement therapy for improving physiological, psychological, and physical outcomes. That has nothing to do with my topic. Okay, I'm not looking at dance. So I automatically know I don't even need to look at that. So for the first one though, music interventions for improving psychological and physical outcomes in cancer patients. So I have the right population. I have the right intervention. My outcome. It doesn't say pain, but perhaps pain is a physical or psychological outcome. And indeed in this study, because I looked it up, it is. They do talk about pain as an outcome. So I can use that. So I would actually click on the title of the article and it will pull it up as you see here. Okay. So to actually open this up as a PDF and read it, up at the top right, you'll see view PDF. So I clicked on that, and then you want to click standard. Summary is too short and full is way too long. So standard. And this could still be like 60, 70 pages long, but it's chock full of the best details you could possibly have. So don't just freak out when you see how long it is and say, I don't need to look at this. So standard, and then it'll actually come up as a PDF. Also, really cool. We talked about clinical practice guidelines. Look right here. It says that this particular study, this systematic review, has been used to build 2 different sets of clinical practice guidelines. Wouldn't that be nice to check those out? Well, let's do it. So I clicked on guidelines and it brought me down to the bottom of that page. And look, here's 2 clinical practice guidelines. Now the problem is that I can't read this top one. This is in a different language. So like it gives you the English title, but when you click on it, it's not in English. So please don't turn that into me because I can't read that. But this one looks okay. Clinical guideline for treatment of cancer pain. So perhaps if I clicked on that, it would be similar to my topic. So it would be nice to know what the researchers say are my best practices, right? Okay. So when you click on the PDF, this one's a little different in mine. Again, I'm on Mozilla. I'm looking through Mozilla and I'm on a PC when I'm doing this video. So it's 130 pages. I'm not lying. They're long. Okay. And this isn't the full. Now note that this is not downloaded. This is just popped up a screen. It's not within Adobe or any PDF reader. So in order to save this, you have to actually download the PDF. I've had students ask me, how do I get this saved? So up at the top right, you'll see this little download symbol and you'll see PDF. Click on that and then you'll be able to open it up. Now you can see it's saved as a PDF and it's opened up in my Adobe PDF viewer. So important step. You will not be able to save it if you don't download it through this process. So that's a good thing to remember for any of these things you're trying to save. Everybody's computer has their own quirks. It depends on what browser you're looking at. It depends on whether you're on a Mac or a PC, and it depends on how you've set up your programs to open. So there, somewhere in your browser, you have the ability to set up how it handles PDFs. Is it going to open it in an in-browser viewer? Is it going to open it in PDF through Adobe or whatever? So I don't know exactly what yours is going to look like, but this will give you some guidance. Okay, so Cochrane, remember, just systematic reviews. They're very long, but they are the creme de la creme of research evidence because I know after reading this exactly what the science says about my topic. So it's super important that we try to find these systematic reviews for our topics because this is the gold standard of what we're looking for.